Well, lovely to have you, Minister Rabbitte, and thank you so much. And we're really privileged and delighted that you could join us. And it really is very special that you are here with us today, and you've been such a support and advocate of and doing such sterling work for people with disability. And it is indeed a real honour and a real pleasure for me to welcome you, and thank you for taking the time and completely understand the demands on your diary. So thank you for that, Minister Rabbitte. I'm going to hand over to you to say a few words.
Thank you, Mary, and good afternoon, everyone. And again, apologies for my delay. And I am delighted to launch this IDS-TILDA report today, which looks at how COVID impacts the lives of older adults with intellectual disabilities during the second year of the pandemic. For over 10 years, since the report of Wave 1 of 2011, successive IDS-TILDA reports have provided invaluable insights into the lives of people with intellectual disability as they age. This data has undoubtedly helped guide government policy and practice across the wider disability sector. Successive reports have highlighted issues like being able to make your own choices in daily life, the extent of contacts with family and friends, engagement in the community, and many aspects of health and well-being. The IDS-TILDA findings help us understand how to promote the well-being and successful aging of adults with an intellectual disability. Indeed, we have used that data with its rich information on health profiles and social consequences and outcomes to inform our approach to the management of COVID-19 for people with intellectual disabilities. However, as we found from the first IDS-TILDA COVID-19 survey, which I launched just over a year ago, the pandemic posed a serious threat to the lives of this population. Many people with intellectual disability experience poorer health than the community at large, and thus are an increased risk of poorer outcomes should they contract the disease. While a growing number of people with intellectual disabilities live in the community, many also live in long-term care settings and grouped residence, which have been identified as a high-risk living spaces for COVID-19 infection. It has been critical that we understand how this population has continued to be affected by the pandemic. And I don't just mean the primary health impacts of the virus, but also the broader impacts on their lives from prolonged lockdowns, service closures, and the separation from family and friends. In line with the COVID surge across society in early 2021, cases also rose among people with intellectual disabilities. The latest survey shows that the population of individuals in the sample who were infected with COVID increased substantially since the first survey in 2020, from 2.5 to 12.3%. This was largely due to the increased number of positive cases in grouped residential settings. As the European Centre for Disease Control has stated, once COVID is widely prevalent in the community, it is likely to enter residential services. It is also true that the high rate of testing of the disability service population in 2021 would mean that positive cases were more likely to be detected. However, there are also important lessons around replacing congregated settings with domestic scale community housing, which are safer environments. This will be an important focus on the Disability Service Action Plan 2022 to 2025, which is being worked on at the moment. It has been hugely encouraging also to see such high rates of vaccine uptake among the older adults with intellectual disabilities. Almost all participants were found to have taken the vaccine when offered. Without a doubt, this has helped to protect individuals from the worst outcomes of COVID infection. In future reports, I imagine we'll see high rates of booster uptake confirmed. The development by the HSC in partnership with service users themselves of suitable accessible information to support informed consent has been most welcome. Once again, people with intellectual disabilities must be congratulated for their high rates of adherence to the public health guidelines. Families and disability services also went above and beyond in responding to the pandemic and their efforts to protect individuals with intellectual disability from the virus and in maintaining their health and well-being during these exceptional difficult circumstances. It is also important to acknowledge the role played by individual staff on the ground, by service provider organisations, public health team, HICWA, in keeping people with intellectual disabilities safe. It has truly been a cooperative effort. While every person's death is a matter of great sadness, it is good to be able to note that the mortality rates in disability services were very low. Great credit is due to all those who worked so hard to keep COVID out of their disability services and to support people whenever they became ill. These efforts, of course, need to continue. While thankfully society is opening again, we know that the health status of many older people with intellectual disabilities leaves them more vulnerable if they do get infected. So we need to continue to be vigilant. And it remains important to follow public health advice if someone displays symptoms in order to prevent the spread to others. It was concerning to hear from the survey that 7 out of 10 participants said that they felt stress or anxiety due to the pandemic. I'm sure everyone here today can identify with the fears and concerns many participants expressed. But we should also bear in mind that these problems may be heightened for some adults with intellectual disability, who may be more vulnerable and sometimes have less autonomy than people without an intellectual disability. I am also heartened to hear that many participants demonstrated resilience and adaptability during these most difficult times. 9 out of 10 people in the survey identified new pursuits during the pandemic. Notwithstanding the real challenge faced during this time, participants indicated that this was a time when they tried new activities, had more time to rest and relax, spend more time with staff, and had more opportunity to use technology to communicate. As society reopens, we look to rebuild our lives, and I'm sure some of these new skills and new ways of life can be maintained. For me, it's particularly important that we ensure greater access to technology for people with intellectual disabilities. I have a particular interest in making much more progress in this area in 2022. Through the richness of the data provided in the IDS-TILDA study, Ireland is now recognised as a global leader in the field of ageing and intellectual disability. Each wave of this study deepens our knowledge and how people with intellectual disability may be supported to age successfully. The insights are so important for policy. The Department of Health has been pleased to sponsor this programme of path-breaking research funded via the Health Research Board. The UN Convention on the Rights of Persons with Disabilities emphasises the importance of the voice of people with disabilities themselves in shaping policies and services. That voice comes through loud and clear in this report. As I launch this report, I must give a special word of thanks to the participants who have taken part in the IDS-TILDA and who made this study possible. My appreciation also goes to the families, support staff, service providers who have helped with the research. The continued success of IDS-TILDA would not be possible without their commitment or without the continuing support of the Department of Health and the Health Research Board. I am delighted to note that we are funding IDS-TILDA for its 5th wave of the research we will commence this autumn. I have no doubt that we will build on success of previous waves and continue to provide government with the critical data it needs to support persons with intellectual disability to age successfully in Ireland. I want to again thank you for the invitation to launch this report, and I look forward to hearing more about the findings. And thank you so much for your patience at the outset. Gora Mahagath.
Thank you so much, Minister Rabbitte. Really great words of encouragement, I think, to service providers, to people with ID, to families, and to the community at large. And I think your sterling support, over the pandemic, to people with intellectual disability and to all of us who are trying to assist, has been really noted, and really greatly thank you, and great thanks and gratitude to you, Minister Rabbitte, for that. And I'm delighted as well that you were able to stay with us this afternoon for a period, and we also appreciate that, given the demands on your diary, etc. I'm just going to continue with a brief presentation, Minister, and just to give an overview of the findings. Great. So as the Minister has mentioned, indeed, and I have mentioned before, that this is the first nationally representative longitudinal study conducted on ageing in people with intellectual disability, where we have comparability to the general population, a random sample selected from the National Intellectual Disability Database. And again, thanks to Sarah Craig and our colleagues at the HRB for assisting us with that. This is a large conceptual framework which underpins IDS-TILDA, and as you can see, as the Minister has mentioned, we have a broad range of data across multiple domains. And this really was critical data for us to support the Minister and indeed service providers in trying to understand those at most at risk of COVID-19, of getting it, and those at most at risk perhaps of adverse side effects should they get it. So when the pandemic happened, it really, we were able to mobilize our existing research infrastructure to provide a rapid response to COVID-19, and really encouraged evidence-informed decision-making by carers, service providers and policymakers, and informed, as the Minister has mentioned, informed strategic responses, and advocated particularly, and working with Alison Harnett, who's here today from the National Federation, to advocate for the increased risk status of the vaccine prioritisation for people with intellectual disability. And as the Minister has mentioned, almost 100% of people who were offered the vaccine were vaccinated. And I think that's really good evidence of everybody working together, services, researchers, and policymakers and department. In the first COVID sub-study report that we published in 2020, that's available to download. There is a number of articles which we have published in HRB Open and the GIDR, looking at the impact around social inclusion and the impact of the overall first wave of the pandemic. And what we found was, as the Minister has mentioned, that we had high rates of testing. There was low rates of infection at that time compared to the general population, but this has indeed increased. We had low mortality at that time. There was no deaths in COVID Survey 1. There was good preparation and planning within services, and I think the Minister has spoken to that. And we were all aware, of course, that there was high risk remained given the health profile and the residential circumstances of people with intellectual disability. And we also needed to critically understand the longer term impact of future waves, and indeed the longer health and social impact, which we can capture now with wave 5 of IDS-TILDA as we hopefully move out of the pandemic. So the second COVID sub-study started we got funding, additional bolt-on funding from the Department of Health in 2021. And this was really following up from the first study and really working with colleagues internationally. And I know our colleague, Professor Chris Hatton, is here with us today to try to look at comparable data across Europe and other countries. And then we went through the usual ethics approval and committee structure. The protocol for our study is now published on HRB Open if anybody wants to access that. So the fieldwork for this second sub-COVID study started in May to September 2021, and we had 682 participants who completed the protocol. And this just gives you an indication of the profile of these 682, a kind of pretty much equal amounts of males and females. All age groups were represented, with the largest age group in the 50 to 64 group. All levels of ID were represented, with the largest age group with those with moderate intellectual disability. Nonetheless, we had 27% with severe to profound disability and also 25% with mild intellectual disability. Residential types, all residential types were represented. Community group homes making up the largest proportion, with 18% living with family or independently and 32% living in more congregated settings. The report is up now on our website, and that will be available for you now to download. And I know Gavin will have sent the link to people, and we've certainly put the link into the chat box so people can actually download the report. So I'm just going to briefly do some comparisons from Survey 1 to Survey 2, and just to remind you that Survey 1 was completed during the first wave of the pandemic from May to September 2020. Survey 2, May to September 2021. So at time 1, we had 10% with symptoms. This increased to 18% in Survey 2. 66% in Survey 1 were tested. This had increased to 75% over time. And as the Minister mentioned, we've seen the numbers who tested positive had increased from 2.5% to over 12% on this second time around. 11% hospitalizations, that remained pretty much the same, just to increase slightly. Again, slight movement, more people had moved, 10% had moved versus 7.8 in Survey 1. And there were no deaths during the first wave of the pandemic. And I know the Minister has mentioned that overall the COVID deaths of people with intellectual disability has been low at a population level. We reported 3 people had died. We don't actually know the cause of death. They did test positive for COVID at the time, but we know that the cause of death for those 3 people have not been confirmed. 2 of them we know had other end-stage life-limiting illnesses. Just looking at those, we had 63 people that tested positive. And just looking at those who tested positive, as you can see here, they were more likely to live in residential care or community group homes. And we've seen this in the previous wave as well, that people in these settings were much more at risk than people who were living independently or living with family. The symptoms of COVID-19 were pretty much the same as what we've seen reported for the general population, with cough and fever being the most common symptoms reported. And we had about 11% that had no symptoms at all. The duration of symptoms, as you can see here, that on average they lasted 1 to 2 weeks, with very few people having symptoms beyond that. So we will be able to look at other impacts of COVID-19 as well, I think, as we move forward. And of course, the big issue with people with intellectual disability, and just go back to this for a moment, is that, you know, there can be difficulty for people with intellectual disability in being able to self-report due to communication difficulties with this population. In terms of hospitalization and mortality, we know that 13 participants with COVID symptoms were admitted to hospital. Out of that 13, 11 tested positive. 1 person was admitted to ICU, and the median length of hospital stay was 3 days. And as I mentioned, though, there was 3 participants who died, but the cause of death has not been confirmed. So I think a lot of the concern that was out there at the beginning with respect to the fact that people with intellectual disability who may require admission to hospital or admission to ICU, we didn't get that picture here in Ireland. Certainly, if people needed to be admitted to hospital, they were admitted and moved on within the system. Well, the median length of stay here was also quite short. Moving home and isolation measures, 10% moved from the usual residence during the pandemic, And the majority of people moved to isolate as a precaution or while waiting test results. And I think what's really positive here, that almost 100% of participants who had COVID-19 symptoms or tested positive had a plan in place to manage self-isolation. And I think this is a key finding, and the minister has spoken to this as well. Services were very well prepared. I think there's a lot that we can learn here for other sectors, particularly the like of the nursing home sector, perhaps where COVID-19 had a major impact. So I think well done to organisations. Adherence to public health guidelines. And again, this is a very positive story, because there was concern, will people with intellectual disability be able to adhere to these guidelines? And many of them, for all of us, were quite, difficult. But here you can see that people with intellectual disability, when you combine the often and always, it is really excellent with almost 70% of people, 60 to 70% adhering almost always to the guidelines. So I think it just really shows the competence and the resilience of people with an intellectual disability. Health changes during the pandemic. What we see here is that, yes, about 24% reported that they got less medical care than they would usually get. But other health changes, I think, and more changes for all of us in society, was that many people spent more time sitting down or being sedentary and less physical activity. And we know how important that is for us all. And I think what is also concerning here is that those with Down syndrome were the group who are more likely to be sedentary when compared to people with ID from other etiologies. And I know we'll have Professor Sean Kennelly on the panel later on, but we know the criticalness of physical activity for people with Down syndrome and its relationship to the criticalness in maintaining brain health and its relationship to dementia. So we really need to get people up and moving again. I think this is really important because it is a multi-dimensional impact on health and well-being. Planned healthcare appointments cancelled during the pandemic. You can see here that about 19.6% had a medical test or screening test cancelled. Annual health checks. I think this is really was surprising to me and really great to see that 81% had their usual annual health check during the pandemic. And for people even who were older, 65 and over, while it wasn't as high as that, over 70% of them still had their annual health check. So I think that is indeed very positive. Healthcare utilisation in terms of consultation with healthcare professionals during the pandemic. Healthcare professionals were seeing 43 to 71% less in person, and that's probably not surprising. But healthcare professionals were consulted 22 to 48% more remotely, so people were using remote consultation, phone or online consultation. So the net reduction overall of around 13 to 38% in healthcare professional contact during the pandemic when you combine in-person and remote. The COVID-19 vaccine information, almost 80% had received government easy to read vaccine information, and 56% found it easy to understand, but 44% found it difficult. And I think, at TCID and the work we do at the centre, we have a lot of skills, and indeed right throughout services as well, in developing accessible and easy read information. And I think that is just so important to understand that going forward. And then people got other information from other sources as well. Vaccine and side effects. And again, there was concern at the beginning in relation to the vaccine programme for people with intellectual disability. But as the minister has mentioned, almost 100% received the vaccine of those who were offered. 30% experienced vaccine side effects, but the side effects were very minor and they lasted less than 48 hours. And I think this is really useful information for us to have should we ever be in the situation again of future pandemics. And we have really good and important information here. So the most common side effects, pretty similar perhaps to most of us had, was tender swollen arm, or perhaps feeling tired. But again, as I say, some people with intellectual disability may not be able to communicate verbally some of these issues. So we need to be very vigilant in terms of particularly things like tiredness and that level of exhaustion that sometimes stays with people for a period of time. So what did it mean to get the vaccine? Delighted and happy. This is what people with intellectual disability had to say themselves. Delighted and happy. Can't wait for the other one so I can start traveling again next year. I'm happy. I was very excited. I could go back to work. I was thrilled to get it. I didn't want to get the virus and I want to be healthy. I'm glad I got it. I am brave. It will keep me safe. I can be an independent lady. I can go and see my boyfriend and my dad. I'm going to the pub for a pint of Smithwick's. So I think, you know, they are the voice of people with intellectual disability themselves. It just shows you the level of understanding that people with intellectual disability had around what was happening and their ability to take that in, and the resilience, I think, that this population showed during the pandemic. Contact with family, 88% had less face-to-face contact with family, and participants in community group home were the most impacted, and 56% used technology to speak to family more. So we did see this massive rise in technology use, which was very positive and welcome, because in the earlier data collection with IDS-TILDA back in 2011 and 7, we reported that the technology age appeared to bypass people with an intellectual disability. So this is something very positive. But I think we need to understand that nothing replaced the face-to-face contact. And when we all use technology, I think meeting people and being able to see people in person was also critically important for people with intellectual disability. And the technology did not replace that face-to-face contact for many. Contact with friends, almost 80% had less face-to-face contact with friends, and participants with mild intellectual disability were most impacted. So those who are living perhaps at home or independently, they found this most difficult. They just were not able to meet and felt very isolated. And I'm sure May Lynn who's on our panel also this afternoon, will want will speak to that. And again, almost 50% of people use technology to speak to friends. But as we all know, most people just want to meet up in person, and we're really looking forward to that happening. The impact on social inclusion and community participation, and there is multiple chapters in the report, and I'm only just giving you a very slight taste of what it is saying, and there's much more detail behind all of this. But we had a long list of activities and we were looking at what was really most impactful for people. And again, it was things like not being able to do usual activities and hobbies, and being separated from family and friends, and reduced work hours. And so many people just missed the day service or the day program that they were attending to. But I also want to draw your attention to something that I think is likely to have longer term impact. That 17.6% were unable to attend in person a funeral or religious service of a family member. They were unable to visit a loved one in a care facility, in a nursing home or group home, and they were unable to be with a close family member in a critical condition. And I think this is going to have much more longer term impact on people as we try to recover from the pandemic, and it's going to be critical to monitor these long-term side effects, because I think for us all, we can all get back out moving, we can all now meet our friends, but for any of us who've experienced the loss of a family member during the pandemic and we were not able to be with them, I think that is going to be much more difficult for us to recover from. And I also think it's really important that for people with an intellectual disability, that we're very mindful of that. In terms of related stress and anxiety, almost 70% of people reported anxiety due to the pandemic. And we know that people with intellectual disability very often have high levels of stress and anxiety anyway, and this was further confounded by the pandemic. And again, the things that were really difficult for people was not being able to do usual activities and not seeing families. So the impact of long and prolonged lockdowns for people with intellectual disability, I think, had much more impact on their mental health than we've seen for the general population. So I think that is an important lesson and issue for us to inform approaches for any future surges or pandemics. And again, life events during the pandemic, 98% experienced a life event, 69% had a change in the frequency of visits, loss of leisure activities, and changes in work or day service, and 46% change in staff. And this was a major life event that had big impact on people with intellectual disability, because we had a lot of changes on staff out sick with COVID, etc. And this was very challenging for people. But I also think that this is really important, that 21% knew someone who had died during the pandemic, and 28% of those deaths were due to COVID-19. And many of these, that 142 participants, were not able to attend those funeral or religious services or participate in the usual funeral rituals, which are so unique, I think, to Ireland. This is just, again, more quotes from what people with intellectual disability had to say about the impact. I used to visit my brother once a month and stay for the weekend or longer. I couldn't do that. My brother lives alone and he misses me too. There was lots of changes in my life and it made me feel lonely and I couldn't see my family. The past few months have become harder and I'm very tired. So what we actually seen was in the first wave in 2020, this was new and people were feeling, oh, it will be over. But as this continued and continued for the long haul, the level of exhaustion for people became much more apparent. Have to take it one day at a time. It is very hard, but that's the way life is and you just have to get on with it. I miss going home at weekends, but now I can go home after the virus. I did lots of activities during COVID. It wasn't a bad time because I had my friends and I had support staff. And I think for people who maybe were living more independently or with family, they missed out a little more because they didn't have these support structures. But 90% reported positive aspects of the pandemic. And we need, as we begin to rebuild back services, we need to really pay attention to this. So 63% said they had more time to relax and enjoy this, and they really did enjoy it. More and better time with staff. So people with ID felt that they were able to be with staff more. There seemed to be less rushing around overall, and people with intellectual disability reported that they enjoyed that and they wanted more and better time with staff. They had more free time, which they enjoyed, and 49% started using technology to communicate with they previously didn't, and 44% had new hobbies and activities. So that's all very positive. No one was hassling me. This is what people had to say. I met my girlfriend. She was really thoughtful and cares about people and friendships. She writes poetry. She wrote a poem advising how to make friends. So this was people with intellectual disability giving back and being very creative themselves. Encouraged, this is what staff had to say, to encourage her to make more choices for herself. She moved into her new home in February 21 and is very happy there. Getting the injection was a very positive thing that people felt. And I'm proud of myself that I went in by myself for my vaccine. So there was this sense of empowerment and self-control reported by people with intellectual disability, which they felt and enjoyed and reported on. So just to conclude, the continued high rates of testing and increased rates of infection among IDS-TILDA participants, as I mentioned, was higher within those living in group home or residential type settings. Testing rates were much higher than for the general population at TILDA at 76% versus 62%, but I want to draw a note of caution to this. And infection rates overtook TILDA at 12% versus 4.2%. But we need to understand that TILDA reflects community dwelling older people. IDS-TILDA population is a different population, and probably because we have so many people living in residential cares, so the infection rates are well below what we see in the nursing home populations. And if we look at those who are living independently or in family residence, we had testing rates was 2% versus the 6.2 that we report for the general population. Lower mortality rates, and the Minister has spoken about this in the IDS-TILDA sample, and it probably indicates the widespread vaccination program and the response by the sector, and just such good level of adherence to the public health guidelines by individuals and services. And the widespread impact on health services and use, I think it was mitigated to some degree by remote consultations, but not completely. So I think there was learning for us all, and some things I think will change probably forever around some of these issues. But the widespread impact on social connections with family and friends, and while technology did help, many were still without access to digital skills, and many missed connecting in person. So particularly those with more severe to profound ID may not have had access, may not have had the skills, so they are always most vulnerable. And then those living in community, the impact of loss of work, of loss of day services and day activities, this was hugely felt. And we heard a lot from family caregivers about the absolute impact of the closure of some of these and the prolonged closure of some of these areas. And then there is, I think, this cohort then, I think, where unresolved grief will be an issue. But we've seen almost 70% had COVID-related stress and anxiety. And this was, all of our data was collected before the Omicron peaks and lockdown. So I think this is even likely now to have increased more, because when we were finishing this report, I don't think any of us were prepared that we were going to have another surge and another strain. We have also looked at moral distress among staff caregivers and moral injury. We have a paper which will be coming out on that, because this was very high, where staff were often forced against, I suppose, their best principles to deliver care in a way that we're so unaccustomed to, not supporting people to attend funerals, not supporting people when they needed to meet with family, etc. And this was difficult for staff. And there was a lot of stress for staff in trying to protect people from actually getting the virus. I think that is, we need to acknowledge that, and I think the Minister has. And there was a number of, lots of positives. Up to 90% of people reported positive aspects, more time to relax and do things differently. And rebuilding, what do we learn from COVID-19? What should we now restore? And what must we replace? And how can some of this data and other data from IDS-TILDA help to inform us? And we aim to investigate again the longer effects of COVID-19 crisis on older adults with ID in Ireland in wave 5 of IDS-TILDA, which we will be rolling out in the autumn. And this, I'm going to finish with this slide because I want to give the last word to people with an intellectual disability themselves. And I think this is what we're all looking forward to. I'm looking forward to going out for coffee and something to eat with my boyfriend, getting my hair colored and cut, going to the saloon for beauty treatments, going to get new sandals for the summer. I'm looking forward to visiting my family and having my independence back. I'm looking forward to having a proper party with the rest of my family when it's safe. I'd like to bring them out for a meal when it's my birthday. So I really did feel it was important that I gave the last word to people with intellectual disability themselves. I really want to thank all of my own team who were so critical with respect to this work and to IDS-TILDA. And again, as the Minister said, our participants, our families, our carers, the steering committee and the scientific committee and our advisors, and above all, our funders that have made this work possible. The reports are available to download. So I just really want to thank you all for listening. And I'm now going to hand over to Michael Foley, who's going to chair a panel discussion.
Thank you very much, Mary, and thank you for that presentation. I keep thinking of a book that I read a few years ago called The Buried Giant, where a whole country gets shrouded in a mist and everybody forgets a traumatic event that nobody ever talks about. And I think we're really at a point right now where there's a real danger that we'll all really, really want to forget the last 2 years. So this report will hold that memory for us, and I think bring it back to us when we think that we've forgotten it, because right now we think we're not going to forget this. We think, oh my God, no, like this was so important, we'll never forget it, but we will forget it. And that's why this report, I think, is really, really important. And I'm delighted to welcome our panel here today, who will help us to talk a little bit for the next 20 minutes or so about the report itself and what's in it. And I know the Minister is in listening mode, but obviously, Minister, if you want to join us in the panel, you're more than welcome to chime in with comments and with observations. But the panel themselves are, as you've heard, Professor Mary McCarron, who's the Principal Investigator for IDS-TILDA, and the Professor of Ageing and Intellectual Disability in the School of Nursing and Midwifery in Trinity College, Dublin. Professor Philip McCallion, who is the co-investigator on IDS-TILDA, who's a professor and director of the School of Social Work in Temple University in Philadelphia in the US. We've got Professor Sean Kennelly, who is a consultant physician in geriatric and stroke medicine in Tallaght University Hospital. And he is also the clinical director of the National Intellectual Disability Memory Service. We have Professor Chris Hatton, who is a professor in the Department of Social Care and Social Work in Manchester Metropolitan University in the UK. We have Dr. Alison Harnett, who is the Chief Executive Officer for the National Federation of Voluntary Service Providers. We have Ms. Maria Kavanagh, who is the Director of Nursing in Stewarts Care. And last, but by no means least, my friend and colleague, Ms. Maylin Yap, who is the TCAID Ambassador Liaison Officer, and she also sits on the IDS-TILDA Steering Committee. And so you're all very welcome. And what I would like to do is, if anybody has any questions, don't forget you can hit the Q&A box at the bottom. And if we have time, we'll try and bring those questions to the panel. But Mary, if I could start with you, I think what's really interesting about this report is that the first report on COVID that you did was very much dealing with the response and the trauma of the start of a pandemic. This response is when we all knuckled in for the long haul. So coming out of this period, what's the really big takeaway for you out of this now?
Well, I think at the very first webinar that I did at the beginning of the pandemic, I said, don't underestimate the resilience of people with intellectual disability. And I'm really glad I said that, because I reflect on this report, I can really see that. That was the first thing. And I think as well that, there was a lot of preparedness amongst the ID sector. And I think we should learn how that worked, and we have people here who will be able to do that. And I think as well, the resilience of people with intellectual disability, their ability to understand what was happening and to be involved and to participate, to me, really was remarkable. And many of the concerns that we had as well at the beginning, there was a lot of talk about, will people get into hospital, will all of these things happen? None of those. There was a lot of things that were just didn't happen.
And actually, interestingly, when we talk about some of the things that we anticipated happening that didn't happen, at the same time, there's a piece in the report about big life events, and a piece about somebody saying, I proposed to my boyfriend and we were going to get married, and then the pandemic started. So there was big life events actually happening. And Maylin, maybe I could bring you in on this. I mean, it's been 2 years. I know you've had some pretty big life events in the last 2 years, and you've done them in the shadow of the pandemic. Do you want to share some of those with us?
Yeah, sure. So during the pandemic, I became an auntie. My sister had a baby, and I am a happy and healthy auntie. And now it turns out that my brother is also expecting a child too. So I'm going to be an auntie times 2, which is pretty big in my family, to have children running around. And then my brother also immigrated to Australia to live. So he will be working and also rearing a child in Australia, and then due home in 2023. As well as that, I also got promoted at my main job at CPL Recruitment Agency. I was the HR assistant, and just last year I just got promoted to senior HR assistant. Then I also, I think it was later last year, I also became the ambassador liaison officer with the IDS-TILDA, which I am really enjoying the role. And
I know it, because you get to work with me, Maylin, I can appreciate it's quite overwhelming.
It is overwhelming for me. I'm absolutely loving the role, and I love the people I work with, and I'm learning so much from everybody. Yeah, so it's been quite a journey during the pandemic, and also along the way, also last year I have a knee injury, and a pretty serious knee injury, which will require me to have more physio on my knee to get fully mobile right now. And then later on in the next year or 2, I will need to have a full knee replacement, which I am not looking forward to. I'm a little bit scared about having that operation. And then also now I am currently looking at living independently as well. So I'm been getting the ball rolling between myself and my mum, and putting plans in place for my future. It's exciting, also scary at the same time, but mostly excited, I think. I kind of feel overwhelmed by the whole prospect of moving out of home, but the time is really now to do it, while my mum is living. So she's putting provisions in place for my future when my mom's no longer with me, which is pretty scary to think of, but
But an adventure nonetheless.
Yeah, for sure.
So I really like that, Maylin, in terms of a reminder to people that people's lives did go on, and people had to face into this in a resilient way. And I suppose what I'd like to do now as well, though, is bring, let's say, Sean in from the hospital perspective, like in terms of people having to be resilient and having to adapt. That certainly at the start of the pandemic, you were a very calming voice for us all, speaking from inside the hospital, which was a real site of anxiety for people. How do you feel that the pandemic, has it changed the way hospitals do their business, do you think?
It does. I mean, and it's and thanks, Michael. And it's great to get the opportunity to chat. And I suppose at this vantage point as well, where we're certainly into that awful phrase, a different phase of it all. But I think resilience comes at a cost. And by its nature, I mean, it's striking and it's encouraging to see that there is a positive appreciation in some reflections. By the same token, I don't think it should be lost that it is at a cost, and that there is a risk inherent in resilience as well, and what we ask of people and what we ask of services. So yes, it's great that they stood up. Yes, I think certainly within an Irish context across the board, they have stood up better than any of us would have anticipated if somebody had described what was going to come at us. By the same token, I think we need to be careful that it doesn't alter our expectations of services. So yes, people have gone on with stuff, but actually there is, some of the things are positive, but actually people should have choice, and we should be resetting choices, and we should be reestablishing that choice for people, rather than, if you like, this new means leading to people having a reduced expectation. There has been delays in access to care. There's been delays in access to diagnostics. There has been, a welcome introduction of virtual care. By the same token, that is an unvalidated or an invalid kind of means of delivery, and we need to get the evidence base around some of these new things that we've taken on board to ensure actually that the quality and the, if you like, the evolution of care is actually as good as we hope it is. So we're kind of in that point now whereby it is about taking stock. I think the other thing is so in the National ID Memory Service, which we have the fantastic news that is going to receive long-term funding, which is wonderful and makes us, one of the few countries in the world to have a specialist memory service for people with intellectual disability. What we're seeing though is people presenting with at a far more advanced stage of cognitive decline, where they haven't had access to those diagnostic services, and that's meant that they're presenting in a more stressed scenario, which has put an awful lot of pressure on staff. And I think also services have probably adapted around having fewer staff, especially with the absenteeism over the last few months. And certainly, so anecdotally, I mean, when people are coming in and out of the clinic, I feel that the reduction of staff means that there has been, sometimes staff have taken on roles and in particular roles, care roles, to support somebody from a timeliness perspective, that we need to reinstate now that autonomy and that ability for people to take on those roles themselves again. So there is a little bit of a reset. So it's positive that we've kind of come through it. I think we've learned an awful lot about what the services can withstand. But I think it is now important actually that that there isn't this wholesale adoption of some of those things that we perceive as positive, and that we realize that there is a cost to this resilience.
Thanks. Yeah, that's great. Thanks for that, Sean. And I hear what you're saying about that need as we move into a new phase. There is that need to really focus on where we are right now, because it's coming out of a period of an extraordinary period, that we don't just expect the extraordinary to become the ordinary, because people had really pushed themselves in order to be able to achieve the extraordinary. And actually, Maria, speaking as somebody who is embedded in services, is that chiming with you as well?
Yeah, absolutely. The resilience can't be understated. And I think for services in general, we really took a threefold approach in support for the pandemic. So preparedness, collaboration, and adaptivity. So because we had information like IDS-TILDA, as previously mentioned by the Minister and Professor McCarron, we knew the vulnerabilities of people with intellectual disability, multimorbidity, social inclusion, communication difficulties, 2,000 people in congregated settings. So we used that to lobby on behalf of persons with an intellectual disability very early, even before there was cases in Europe. And we looked to develop systems to reduce those vulnerabilities. So we had made sure the appropriate PPE was available, that there was training in relation to IPC and PPE for staff. We developed the isolation centres, as Mary mentioned earlier, individualised isolation plans and group isolation plans, and they were very important. And we developed accessible information and staff contingency plans for continuity of service for people as well. And then collaboration was extremely important. We collaborated across disability services and with other groups and organisations. And through that, we were able to offer training across our services to develop and deliver vaccination programs, testing programs. And we shared our experiences, we shared our knowledge, and we even shared our PPE where we needed to. So all of that was really important. And we continually reviewed restrictions and made adaptations to make sure that they were safe, but they were the least restrictive as they could possibly be. Particularly for people in isolation, we provide accessible information. We had bespoke day services, individualized day service, meals on wheels, supports such as nursing supports for people in independent living that wouldn't have needed them before. So we were constantly adapting services in that regard.
Yeah, and interestingly, I suppose, and I might bring you in on this then, Alison, that you, certainly we could see that, and certainly I hope TCAID helped to support that work as well. But
Absolutely.
for you, Alison, I suppose working across representing the services, you know, what kind of strains were you seeing and what kind of response could the Federation bring to that?
Yeah, well, I think just to congratulate everybody who participated in the study, who gathered and analysed it, because what it has given is evidence that can guide us in our practice. And I suppose what the story of the evidence presented today is reflecting back is the extent to which this pandemic is a story of interdependence, I think. And so we've heard about how none of this would have worked if the people themselves didn't take a very empowered role in their safety, if their families didn't take on additional responsibilities in some cases where day services had to close at some points, if the staff hadn't gone above and beyond and very, very carefully implemented all of the infection prevention controls, the service providers, the HC, the public health, and then the policymakers and the minister right behind us at all stages. And what we were able to do with yourselves in Trinity was look at evidence across the international stage and bring it as advocacy in terms of ensuring. So some of the things that we were very involved in was the vaccination and booster program. They were key focus for us. And I suppose that the report also tells us the story that we experienced, and as you've said, and mines that story for us about the lack of infection and mortality on the positive side, and then some of the challenges that people really experienced, the difficulties in having people visit, the stress and anxiety. And we can see that as Delta came through and as Omicron has come through more recently. And recently we've had up to 30% of our staff off at any one time. And an enormous challenge, which has been minding the rosters in the residential supports over Christmas with staff who've been really exhausted, who've worked through holidays that they were waiting for all year last year as they'd coped with the pandemic. So to really echo what Sean is saying, there are very, very tired people. I saw the tired comment in what people were saying themselves. I think there's tired people across the different sectors. And I think I'd love to see this evidence help us mind one another and that partnership and collaborative approach, because the interdependence where everybody took their role and did what was required is what has shored up the success of the pandemic. And I think the positives coming out of it are some things that we can really work from the will and preference that people have been empowered to express about what they would like to see from their service. Something that I'm really delighted to see, and hope that we can all, again, in that partnership approach, look to see how we can respond to that further. But certainly, I think the story that I'm hearing and reflected back through the evidence, which again tells us what we need to do for practice, is that we are interdependent and our success has been based on that positive interdependency.
Thanks for that, Alison, and very well said in terms of what's been happening across the sector, and that the need to, again, in the same way as what Sean was saying, that need to really be able to reflect and move forward based on what's happened. If I could bring in a kind of an international perspective on this now, Philip, if I could come to you, obviously, you know, the US is a very big and broad territory, but how, in terms of what's in this report, how is it comparing with what's happening in the US?
Yeah, so I feel like I've had a sort of unique perspective through my role in IDS-TILDA. I've had a virtual foot in Ireland throughout COVID and an actual foot in the United States watching all of this. Struck too by that we have in the US, there's a much greater percentage of people with intellectual and developmental disabilities who are living independently of the system. So we've had the concern both for what's happening within the formal services and on the informal side. And the picture, and then the picture varies because states are so different, and because of the politics, frankly, of the United States at this point, and where COVID has fallen within those politics. But there are some things that, just a few thoughts. I think, first of all, that I want to pick up on what the minister said about technology and the need to focus in on that for 2022, because saying that we are going to enable people to be able to communicate with family members or friends by technology, that's great. Fine, we put in some laptops and we make some internet available, but what about the person that you're trying to communicate with? And so we've had to do a lot of work for those older parents so that they're ready to be able to communicate as well. We're looking at telehealth. We see what was achieved by that. How do we sustain that going forward? So there's a lot of attention to sort of how do we get the equipment out? How do we improve internet? How do we improve the readiness of all of us to make the fullest use of that? I had an eye exam through a telehealth. I actually laughed at the person when they said to me they were going to do it through telehealth. I was like, how can you do an eye exam? And yet we did. And I'm not sure I want to go back to doing an eye exam in person. So how do we make that level of accessibility available for people with intellectual disabilities as well? So we're looking at that going forward. But I want to pick up on what Alison said as well in terms of, we've moved into Omicron. We saw a much higher level of infections among staff and just in the population in general. And, it's just continuing to teach us we have to be ready for this for the future. But I suppose a couple of things that I'm thinking about a lot is we need to know a lot more about what happened for families who were caring at home. And IDS-TILDA has a family carer study, and we'll have an opportunity to look at that. I think we all need to look at that and what were the supports that we didn't provide and perhaps could provide going forward. We have to be thinking about how do we deal with a situation where perhaps a third of your staff, as Alison said, have infection. What are the ways in which we cope with that? But I think too, I was very struck by a piece that came out that talked about the joys as well as the stresses of COVID, not to lose sight of what was achieved, not to lose sight of that there were some things that were actually a little bit better. And are we just going to go back to the lives as they were? I think that's what we're struggling with in terms of the workplace. Are we just going back to the lives that were? Or are we going to learn from this and lead better lives for all of us, and particularly for people with intellectual disabilities?
That's great. Thank you very much, Philip. And maybe, Chris, I could bring you in on this as well in terms of where we're going next. Obviously, in the UK, you're very heavily involved in what's called the Coronavirus and Learning Disability Study. So, you're doing something that's very much paralleling what we're doing, but in a very different context.
Yeah, so I think one major thing is that how lucky, or not lucky, how planned you were to have the IDS-TILDA study, because we were having to start things from scratch. And the real value of IDS-TILDA is that you can track people from before the pandemic through and hopefully beyond as well. So I think that's a real strength of IDS-TILDA, having those infrastructures there, which are valuable in a place like this. I mean, the context in the UK and particularly England is quite different in many respects and much less positive than Ireland, it has to be said. So we've seen mortality rates of about 4 times greater for people with intellectual disabilities in England. Infection rates are twice as high. Again, we've seen increased rates of mortality where people are living with a lot of other people in the same place. UK, and especially England, has been late to lockdowns and very quick to lift restrictions. And that means that England in particular is running very high general population rates of COVID, even before Omicron, and now particularly through Omicron 2. In terms of what we found, a lot of very similar experiences actually to IDS-TILDA, so I won't talk about those in any depth. I guess the big things for me moving forward are, as you've seen here, that people with intellectual disabilities and family members and support workers and care staff have really done their bit for themselves, and also people were really concerned about other people too in terms of COVID. So they were kind of doing their kind of public duty and doing it really well. So in England and the UK, people and families have fulfilled their side of the social contract. And it might be that as we're coming through the pandemic, as we've talked about kind of what services are coming back or not, what they might be, it might be time for a new social contract. It might be a really good time when some things are in flux to actually stop and have really fundamental conversations with people with intellectual disabilities, with families, about what they want their future to be. Because people have seen some positives, people might not want things to go back to exactly how they were. They might want things to be different in some ways, but as you said, Sean, not just sort of reduced. I think there's a real issue, again, as you've spoken about, Sean, about people who've missed out on healthcare and social care for quite a long period of time. If you think about things like postural care, occupational therapy, physiotherapy, speech and language therapy, what are the consequences of missing that, as many people have in the UK for a long period of time? You know, it isn't a question of simply starting again. There are consequences of that absence, which I think are really important. In England, and I think this is a really vexed issue, is that the lifting of restrictions for everybody actually has a paradoxical effect, in that there are many people with intellectual disabilities who haven't been able to get vaccinated. Vaccination rates are very high, but in terms of health reasons or kind of people who are immunosuppressed, that there are some people for whom vaccination is not possible, or people who are still at extreme risk, even with some vaccinations. Lack of restrictions for the general population means that that group of people are immensely restricted. So people are still in effect shielding. We found last summer that 20% of people with greater support needs were still in effect shielding, not going out of the house at all. In England, there is no roadmap, as we like to say, apparently. There is no roadmap for that group of people about what happens, about how people are going to be supported, and what a society who is running still fairly high case rates is going to do to support people in the longer term. And they're a group of people, and Philip, you mentioned families as well, who I'm really concerned about. There are people and families who've been going, providing support, often what feels like on their own, for long periods of time. They see no way out and they feel forgotten and abandoned. And that is a group that I'm really concerned about. And that overlaps to my final point, I guess, which is about people with profound and multiple learning disabilities, where continuous and ongoing support is really important. There, many family members have talked about people's world shrinking, and people's world shrinking to the point where they're concerned that their worlds cannot expand again. And I guess that's a group of people that I guess I would want to pay particular attention to.
Thank you, Chris. Thank you very much for that perspective. And I think what you're talking about, it does chime, with some of what we're considering and what we're wondering about and what we're suspecting that, that we really do need to dig into as we move forward. So Mary, can I bring the conversation right back to you, and we might finish on this in terms of how we move forward then, in terms of where we're at and how we, what are the immediate next steps, and then in a broader sense, where are we going?
Yeah, well, I think we have to look at the learnings from everything we presented today, and I think there's a lot of learnings there. But I think there is, and that's why I highlighted that group of, it might have been 20% group, who had lost people who were really, really restricted. They are just such an important group. We need to listen to what people had to say. And as you say, there was positive things, and we need to understand those positive things and hear, not only listen, but hear and take them into account as we rebuild back services. But I think the networking that we've seen, the networking across organisations in Ireland, the network across academia, the network across, our department and HSE, that needs to continue. I don't think that was ever as strong as it was. So we shouldn't lose that now. I think that's really important. But I think the long-term mental health effects of people and those who are most vulnerable are really an important group to look at. And many of them, as Chris has said and others have said, are still restricted. So I think people have been hugely resilient. And I do want people to take that home message. But I think it, as Sean has said and others, it has been a burden. And we've just looked at, disenfranchised grief and moral injury for staff and moral distress for staff, which is a major issue. So how do we support staff who have been, and families who have had this massive load to carry for the last 2 years, and it's still not ended? And many of them are wondering, will it really open up again? So, for me, I think we have a lot of good work has happened here. We have to learn, keep what was good, but certainly to me, things like remote contact with family and friends is no replacement for actually physically meeting people. And for many healthcare practitioners as well, there is nothing, you know, while we may do some remote telehealth, I think for many people with ID actually being able to visit and missing out on those critical services. Like I think we've seen to the memory clinic, so many people were coming in with, you know, is it the impact of COVID, cognitive decline, reduced ability across multiple sectors? And we got now to really understand that. And I think IDS-TILDA will help with that going forward because we can track some of those more long-term impacts. But I think the collaboration that was established, we need to keep it as we build back better again together.
Great. Thank you, Mary. I have committed the mortal sin of any moderator. I've gone over time, but I don't care because I just really valued and appreciated everybody's contribution. I think there was so much within that. I almost feel like we could go on for another hour because there's so much more. I know that Alison could talk at length about technology and intellectual disability. I know that Maylin can talk at length about friendship and about, you know, how she's building that back. I know that Chris and Philip and Sean and Mary and Maria all have experiences in different areas, I think, that can really fill out this picture around things like brain health, around service delivery, around underserved populations, around all kinds of things. And as you all know, Mary McCarron, people could sit and listen to her all day. And we didn't even hear from the minister, who I'm sure could probably keep us going in terms of the disability service plan and how that is shaping up. But so I don't care that we went over time, and I'm only sorry that we didn't go over time by another hour. But what I will do now is I will hand you back to Mary McCarron.
Okay, thank you very much, Michael. And I think it attests to the interest and the commitment of our minister, that the minister has been able to be with us here for almost an hour and a half. And I really do want to thank Minister Rabbitte for your outstanding support to the sector. And as we build back better, I have no doubt we're lucky to have you on our side. So a really sincere thank you for that. I really want to thank Chris and Michael and Philip and Maylin, Maria, Alison and Sean. I want to also thank Margaret Haig, our project manager, Gavin Dan, who does just so much work behind the scenes, Darren McCausland, and all of the people who were involved in the writing of what is really quite a comprehensive report. Eilish Burke and Andrew Allen and a whole number from the team. And I really do want to thank everybody. I probably has forgot some people there, and all of our committees who are so great. I'm really looking forward now to working with everybody as we commence wave 5. We will include different questions and areas that we feel are important for us to capture. And I think we are, as everybody has said, very privileged in Ireland to have this longitudinal study where we can continue to track and provide data to really build evidence-informed policy making. So all I just want to say is to wish everyone very well and to thank you all for your input today. Thank you.